Hey folks, thanks for hopping on. We're gonna give it 5-ish minutes to let other folks hop on, and then we'll get started. Hey folks, thanks to those of you that have hopped on. We're gonna give it a couple more minutes before we get started, let some stragglers come in. All right, we can go ahead and get started. Thank you everyone for joining us this evening for this exciting webinar that we are about to have. I hope all of you are home safe and healthy with your friends and family and able to get through these times that are really uncertain and really challenging. So thank you for carving out some time to join us this evening. We've actually had an overwhelming and unexpected level of interest in the webinar, and so thank you for being people that care about these issues and want to learn more and want to stay engaged during these times that are sometimes difficult. And so after the webinar, we will be emailing all the folks that have RSVP'd with the recording of the webinar, so keep an eye out in your inbox for that. As of a few minutes ago, we actually had 140 people RSVP'd, which is really exciting. We don't have that many people on the call today right now, perhaps because I sent an email saying that there would be a recording of the webinar, but regardless, it's just an amazing show of folks that are engaged in these issues and want to do more. So with that, I'll just introduce myself. My name is Sarah Sneed, and I am a organizing representative with the Sierra Club's Beyond Coal campaign here in Colorado. I actually live in Denver, but I have roots in Northern Colorado. My first job after I graduated college, I took an organizing job and organized the campaign to commit Colorado State University to 100% renewable electricity by 2030. So I've got roots in Fort Collins in Northern Colorado, but now in my role with the Sierra Club as an organizer, I work with folks in communities all across the state to support and help build a grassroots movement to advance clean energy and protect a livable climate for all of us and for the future. And so I'm just so excited to be here with all of you today. Some of you may know me, and if not, I hope we can meet in person sometime soon. And so before we begin, I have a question that I want to pose to folks. And so I'm going to launch a poll. And so you should see this on your screen. And what I want to know is, where do you live? In particular, I'm curious if you live in either of these 4 cities. You're probably wondering why, and I'll elaborate on that in a second. But if everyone can take a moment to fill this out. So the reason I ask is that the Sierra Club's Beyond Coal campaign, in partnership with a number of other organizations in these Northern Colorado towns, Fort Collins, Longmont, Loveland, and Estes Park, we're reaching an important decision-making point when it comes to the campaign to advance clean energy in Northern Colorado. For folks that don't know, if you live in Fort Collins, Loveland, Longmont, or Estes Park, you get your electricity from the same provider. It's pretty cool. That provider is called Platte River Power Authority, and so they're a generation and transmission association, meaning that they provide electricity for those 4 towns: Fort Collins, Longmont, Loveland, and Estes Park. And so if you live in those 4 cities, you have a really critical voice in being a part of that decision-making process and deciding where you get your energy from. And this year, PRPA is approaching a really important decision-making point for where your energy comes from. And so if folks can take a moment to fill that out. So by the end of this year, PRPA will be finalizing its long-term energy plan, which means that they will be making big, important decisions about what kind of power they will be providing to their customers for the next 5 to 10 years. Right now, as it stands, the majority of PRPA's electricity that they provide to Fort Collins, Longmont, Loveland, and Estes Park is coal-fired power. And this energy, this energy plan that PRPA is finalizing this year is really a key opportunity for folks in these 4 communities to make it clear that we need to be planning for a future that's a clean energy future, that's not powered by coal-fired power and by fracked gas, but by clean energy, because ultimately our health, the future of our communities, of our climate, of our friends and family really depend on it. I'll go ahead and close the poll. Just this past week, the American Lung Association published a report on the state of air quality across the United States. If you haven't seen it, it's work it's worth checking out. It's called State of the Air. And in that report, they found that Larimer County, Boulder County, and Weld County all received a failing grade for air quality, meaning they received an F on their report. And now we know that there's a link between air pollution and the severity of the coronavirus in those that contract the virus. And so it's really clear that there's never been a more important time to be protecting our communities and those we love from the harmful impacts of air pollution and poor air quality, which is impacted by fossil fuel combustion from sources like coal-fired power and fracked gas. Not to mention the whole climate change thing that we're all concerned about, right? And so Dr. Crooks's expertise that he'll be sharing today is on the impacts of air quality and air pollution on human health. If you don't live in either of these 4 cities, this webinar is still going to impart lots of really critical knowledge for everyone. But I just wanted to share that background context because it's really important. It's an ongoing decision-making process that's happening. And I really wanted to take a moment to invite everyone to take action. And so I'm going to share my screen. And you should be able to see on my screen a link. If you go to sc.org/PRPA, it's a link to a petition calling on Platte River Power Authority to commit to retiring their coal plant that is currently slated to run until 2046, which we know is way too long, not commit to building any new gas infrastructure, and ultimately chart a path for a clean energy future for the cities of Fort Collins, Loveland, Longmont, and Estes Park. And so if you live in either of those 4 cities, this is a really quick, easy way to make your voice heard and make it clear that, you know, our Northern Colorado communities are ready for a clean energy future, and we need to work together with our utility to make that happen. And so if you don't live in either of those 4 cities, but you want to get involved in some clean energy organizing where you live, we're probably doing something. And so I put my contact info on the screen. Feel free to shoot me an email or give me a call or shoot me a text, and I can get you plugged into what's going on. All right, and so now let's dig in. We have such a treat tonight. Dr. James Crooks is a researcher with National Jewish Health in the Division of Biostatistics and Bioinformatics. He's an amazing speaker. I know you're going to love the webinar we have this evening. And so we'll go ahead and get started. Quick thing, following Jim's presentation, there will be a question and answer session. And so folks, if you're not familiar with GoToWebinar, I know it's a little clunky. To the right of your screen, you have various menus. If you go to the questions menu, there's an opportunity for you to send questions. If you have an option to send it to the presenter directly or to send it to everyone, be sure to send it to everyone. Since Jim will be answering the questions, I will be taking the time to read them to him live as they come in. And hopefully that will flow well. So, all right, without further ado, Jim, let me make you the presenter and we're good to go.
Great, thank you everybody. I'm gonna turn off my camera and share my screen now, but thank you, Sarah, so much for the opportunity to speak to this group today, and thank you all for being interested in this topic. I hope you get a lot out of this talk. And those of you listening live and those of you listening to the recording. And I'm sorry we can't meet in person, but hopefully we can at some point in the future. So I think you should now be able to see my screen. So it has the title of my talk, which is Pollution, Public Health, and Pandemics. A little about me, I'm an associate professor at National Jewish Health, which is a respiratory research hospital in Denver, Colorado. I'm also a clinical assistant professor in the Department of Epidemiology at the Colorado School of Public Health. So I'm a sort of hybrid between an environmental epidemiologist and a data scientist, and I do research on air pollution's health impacts, and particularly how they intersect with climate change. And this pandemic has kind of pushed a lot of scientists outside of their normal, sandboxes to studying an infectious disease where they are maybe have not done a lot of that in the past, and that's the same for me. I have not done a lot of infectious disease work in the past, but there has been enough work on how air pollution interacts with this particular one that I think you'll find it interesting. Okay, so this talk is going to be really focused on, we're going to start out talking about air pollution, what it is, how it affects people's health, then tie in the COVID-19 pandemic and see how that relates to air pollution and health. And then at the end, we're going to pivot a little bit and talk about climate change and how it interacts and intersects with kind of all of the above. And while it is tilted toward folks who live on the Front Range, and particularly the North Front Range, I think probably 80% of this talk will be relevant to people who live outside that area too. All right, so to start with, we'll do a little quick primer on some science of air pollution. Now, if you have spent all of your life in Western Europe or North America and have not traveled in the developing world very much, it may be a shock to you when you go there to see just how bad the air pollution can be in other countries. And in fact, the air pollution is so bad that air pollution globally is the 4th highest ranking risk factor for death, which is a shockingly high number even to me when I first read about it. I had no idea it was anywhere close to that. That includes indoor and outdoor pollution, but together they total 5.5 million deaths as of 2013, or 10% of all deaths in that year are ascribed to air pollution, which is a huge number. I mean, if you think if there was a war that killed 5.5 million people in a single year, we would definitely have been talking about it a lot more than we've been talking about air pollution. So big burden, but spread over different countries pretty broadly. Not evenly, of course. Countries that have lots of people will have lots more air pollution related deaths. But the air pollution related deaths are also related to, how much heavy industry there is without emission controls and how much indoor cooking there is with dirty cook stoves. So countries that have all of those features tend to have a lot of burden of air pollution mortality. So countries like India and China. Other countries that are maybe a little smaller and maybe not quite as industrialized, like Pakistan, Indonesia, there's also a significant burden. And despite its large population, we really don't have a significant burden compared to China and India in the United States. And that's not an accident. That's actually not just some freak, circumstance having to do with geography. That's actually a policy choice that the United States Congress made in 1990 in the form of the Clean Air Act, and that it then updated again in the year, it started out in 1970 and then was updated most recently in 1990. And to my mind, the Clean Air Act is really the linchpin of environmental protection in the United States because it is very hard to wiggle around, unlike our water safety and chemical safety statutes. There is really no getting around the Clean Air Act. And it has done actually an admirable job of doing what it set out to do, which is lowering air pollution in the country. This is why when we go to places like Delhi or Beijing, we are shocked at how bad the air pollution can be. So what pollutants does the US EPA regulate under the Clean Air Act? There are a couple of different categories. The first are called criteria pollutants. And I don't actually know where the word criteria comes from, but what that really means is these are pollutants that Congress specifically said the EPA has to regulate, and it's written in the statute itself. And these aren't just regulated at the emission source, but they're regulated at the area. So they're regulated, their overall concentrations over large areas like cities or big chunks of states are what are regulated. And the 6 criteria air pollutants are carbon monoxide, which is a product of incomplete combustion, sulfur dioxide, which you get from oil burning or some of the dirtier oils, as well as coal burning, ground level ozone, which we'll talk quite a bit more about later on, nitrogen dioxide, which comes from cars and certain kinds of power plants, particulate matter or just airborne particles, and lead. All of these have come down significantly since 1990 when the most recent version of the Clean Air Act passed. The next category of air pollutants that are regulated under the Clean Air Act are hazardous air pollutants, which are regulated at the emissions site, so like at the smokestack, like in this picture. And these are pollutants like mercury, which are known to be toxic. Another class of chemicals called polycyclic aromatic hydrocarbons, which are known to cause cancer, and a different class called volatile organic compounds. And these are really important for ozone formation, so we'll be talking about them a fair bit. But they have many different sources, many different kinds of VOCs with many different toxicities. Some of the sources are natural, so plants actually emit VOCs at certain times of day, but they're also industrial sources. If you think gasoline smell that you smell at the gas station when there's gasoline that's been spilled on the ground, that smell you're smelling, those are VOCs. Natural gas itself that we use to like heat homes and things, that is a combination or a mixture of VOCs. So there's quite a few different sources. And there's a third, it's not really a category of air pollutants, but there's this third way that the EPA can regulate air pollutants, and that's through an endangerment finding. The Clean Air Act leaves open the possibility that Congress did not know about all the possible air pollutants when it wrote the statute, and allows the EPA to find new air pollutants to be harmful and then regulate them. And the one time that's happened where it's really important is in 2009 when EPA released an endangerment finding for greenhouse gases. Problem with that is, of course, the next administration to come in doesn't necessarily agree with that endangerment finding and tries to roll it back, which is what is happening now. But that is something that the statute allows. Now, today's talk, I'm really going to focus on a few of these air pollutants, particularly particulate matter, ozone, and a little bit on nitrogen dioxide and VOCs. So to start with, let's go with particulate matter because that's probably the most important globally. So particulate matter just refers to solid and liquid phase particles that are floating in the air. And, you know, that is a very broad class of things with different densities, different chemistries, different mineralogies, different shapes. But from a health perspective, what seems to matter most is actually the size, because the smaller the particle, the further it can get into your lungs, and the further it can get into your lungs, the harder it is to expel or to break down. Okay, so when we talk about particulate matter, we tend to talk about it in terms of size bins. So we'll talk about a size bin called PM10, which means particulate matter less than 10 microns across. And if you think about the width of a human hair, which is about 50 microns across, then 5 of these particles can fit across the width of human hair. I have my width of my hair is 0 microns, so that doesn't really apply to me, but other people, maybe this is relevant. 2.5 or fine particles are particles less than 2.5 microns across. You can fit 20 of them across the width of a human hair. And again, the smaller the particle, the more likely it is to get all the way deep down into your lung. Particles of this size can get all the way down to the alveoli, which is where the gas exchange happens with your bloodstream. So very important. Sometimes we also talk about the intermediate size bin between 2.5 and 10 microns, also known as coarse particles or dust. So like if you see dust motes in the air in a sunbeam in your house, it's probably particles in that size bin. And finally, recently, there's been a lot of attention on ultrafines, which are really tiny particles. There's not a strict bin size yet defined for them, but less than like 1/10 or 2/10 of a micron. And ultrafines are so small, they can pass through basically any biological barrier that your body has against invasion. So we found them in placentas, we found them in the brains of human cadavers and hearts. So they can pretty much travel anywhere in the body. Now, where do these particles come from? Well, there's lots of different sources that emit particles, everything from burning fossil fuels, brake and tire wear on cars, diesel exhaust, natural sources like wildfires, dust storms, and sea salt. But particles can also form in the atmosphere from condensation of gases. So there are also secondary sources. So the gases emitted from fertilizer or from vehicle and power plant exhaust, or leaks from oil and gas development, the gaseous leaks from that kind of development. Those are gaseous air pollutants that can then condense and cause particles to form downwind. So like natural gas, when you burn it in a power plant for electricity, there's virtually no particles that come out of that smokestack. But the gases that come out of that smokestack can encourage the formation of particles in downwind areas. All right, why do we care about these particles? Why did Congress require them to be regulated? Well, we've known since the 40s and 50s during the London fog events, where there was so much soot in the air from coal, people burning coal in their homes for heat, that you couldn't even see your hand in front of your face. And there were huge spikes in people that went to the, in numbers of people who went to the hospital and who died. We've known for a long time that particles in the air somehow affect your respiratory health. So exacerbating asthma and emphysema. And you can tell that today if you walk outside in the summer when there's a high wildfire smoke day. You can feel the tightness in your chest. So we know it can cause, exacerbations. In the 1980s, though, as science improved and we began to figure out that it was the smaller particles that were more important, and the bigger particles you just cough and sneeze out, the smaller ones are the ones that really have impact. We began to find links with kind of longer-term chronic health problems like lung cancer and COPD. The stuff really got interesting in the 1990s, though, because as we started studying smaller and smaller particles like PM2.5 that can get all the way to alveoli, began finding links between the fine particles and health endpoints we never would have expected to see. Things like strokes, heart attacks, and congestive heart failure. Wait, what? This is an air pollutant that you're breathing. How would it impact your heart? That's a very surprising result, but it turns out that the effects are really, really strong, and at this point, very, very well described. So we know that this effect is there. We know that it's real. We understand why it's happening, and it turns out the overall effect magnitude is very, very strong, in part because a lot of people already have cardiovascular disease that fine particles can exacerbate, but also because it's just a strong effect on any given one person. Like the effect size is stronger than for many other kinds of health outcomes. So in fact, when we looked at that first slide at the global burden of diseases, where it said air pollution was the 4th leading cause of death worldwide, the reason is because of the known links between fine particles and cardiovascular disease. But why is there this link? That's a really weird thing to be linked together. So what's the deal there? How is this working? What's the mechanism? And it's kind of complicated, but I'll try to break it down into just a couple of terms here. So inflammation and oxidative stress are really the mechanisms. So if you think about, inflammation, if you get a cut on your arm, after a day or two, or maybe a few hours, it starts to turn red and get puffy. That's because your immune system is sending what are called inflammatory cytokines, that is certain kinds of chemicals and molecules to the area to try to kill any potential invaders that are sneaking into your bloodstream. That doesn't just happen in your skin, it can happen anywhere in your body there's an invader. Your immune system sends these inflammatory cells or inflammatory molecules at the invader to try to kill it. And one of the ways it tries to kill it is through oxidative stress. That is, it tries to take excess oxygen molecules and essentially attach them to whatever the invader is. Oxygen is super reactive, and so if you get enough oxygen attached to an invader, it'll tend to break that invader down or kill it. Okay, so inflammation and oxidative stress are really, really important aspects of your innate immune system that your body needs to fight off invasion. The problem is if, that works really nicely if you're exposed to like a flu once every 2 years. But if you're exposed to particulate matter constantly every day of your life, these inflammatory cytokines and the excess oxygen atoms are constantly being produced, and they're really kind of stupid. Like they don't necessarily know that they're attacking the invader. They'll just attack anything they're nearby, and including tissues of your own body. And they don't necessarily stay where the invader is either. They will also sometimes spill over and flow into other parts of the body via the bloodstream. So you can get systemic inflammation and oxidative stress from constant exposure to particulate matter. And it's that inflammation and oxidative stress that can damage your heart, that can damage your arteries, that can cause cholesterol plaques to break down and cause blood clots. So we know a lot about the mechanisms, but it all ties back to inflammation and oxidative stress. Now, it turns out inflammation and oxidative stress don't just exacerbate cardiovascular disease, though. They also exacerbate many other diseases. So since the 1990s, there's been a huge explosion in scientific knowledge about what air pollution does to the body, in particular through these mechanisms of inflammation and oxidative stress. We've been able to find links between fine particle exposure and everything from congenital birth defects, low birth weight, developmental delays, and behavioral problems in children, autism, dementia, Alzheimer's, and Parkinson's. cognitive declines, metabolic syndrome, diabetes, and obesity, and the list just keeps getting longer. There was a paper just last fall that came out showing links to, kidney diseases, which nobody would have thought to look at 5 years ago. So this just goes to show that the overall health footprint of fine particulate matter, we still haven't quite figured out the boundaries of, but it's vast. Even if it doesn't affect any of these outcomes super strong, the fact that it can increase the risk of all of them means that the overall impact is quite large. So now let's turn to ozone. Different air pollutant. This one, gaseous air pollutant, just made of 3 oxygen molecules together. So size doesn't matter here because it's always the same size, but what really matters for health is the location. So it turns out that we really need ozone high up in the atmosphere. So you may have heard of the ozone layer that protects us from the ultraviolet light from the sun. We need the ozone layer. Without it, we would get sunburns within 5 minutes of going outside. So it protects us from sunburns, from skin cancer, from cataracts. That ozone layer is, a big reason why life was able to evolve on our planet. That being said, tropospheric ozone, that is ozone at ground level, is very bad. Remember how I said that oxygen is super reactive and tends to damage the things around it? Well, that's all that ozone is. It's just 3 oxygen atoms in a very unstable configuration. So as soon as you breathe it, you get oxidative stress in your lungs, you damage the lungs, it can cause inflammation in the lungs because your immune system interprets it as an invasion and sends those inflammatory cytokines there too. And those then can spill over into the rest of the body, just like with particulate matter. Now, it's important to note that it's the same ozone. We're talking about the same ozone in different contexts. It's just one context, it's protective, and in another, it's dangerous. Now, when we talked initially about the criteria air pollutants, I didn't actually say where ozone comes from because there are no actual emission sources for ozone. Ozone is entirely formed in the atmosphere through chemical reactions. Now, the precursors for ozone are nitrogen oxides and VOCs. Those we do emit. So nitrogen oxides from traffic and power plants, VOCs from natural sources like trees, but also traffic and power plants and natural gas leaks and all kinds of things. But the reaction that creates ozone only really gets going in the presence of heat and sunlight. So it's very temperature sensitive. In cold air, in cold times of year, the reaction doesn't really go forward, and the nitrogen oxides and VOC just stay put and don't react to form ozone. But in the summer, when it's hot and sunny, that's when the reaction gets going. That's why when you see the ozone alert days and ozone action days and the signs on the highway asking you to carpool, you only see them in July, August, September. You never see them in January because it's just not warm enough in January to form much ozone. Now, why do we care about it? What are the health impacts? Well, since studying smog in LA and other cities in the US in the 1970s, it's been very clear that ozone, which is a component of smog, is strongly tied to asthma, emphysema, COPD, and kind of short-term exacerbations of those diseases, right? Asthma attacks, COPD exacerbations, people get sent to the hospital, that kind of thing. But as with particulate matter, as science has started understanding more about how air pollution can increase inflammation and oxidative stress, well, ozone certainly causes oxidative stress. It kind of can't not. And we've now figured out that inflammation and oxidative stress are related to many other diseases besides respiratory diseases. We found links between ozone and cardiovascular diseases, heart attacks, strokes, metabolic changes, Alzheimer's, and type 2 diabetes. And again, the list keeps getting longer. It's not quite as long for ozone as for PM 2.5 because it's just not studied quite as much. But still, the overall health footprint of ozone is quite substantial. And that's important for us here in Colorado because we actually have a really high natural background for ozone and a whole lot of industry that spews out ozone precursors. So we have high natural background because of our climate and our altitude, and we have a whole lot of precursor emissions of VOCs and NOx from traffic, from heavy industry, from oil and gas leaks, and of course, from the natural environment as well. Now, you may have read in the news a few months back that EPA recently downgraded Colorado to being a serious violator of federal air quality standards. So the terms here are, we are now in serious non-attainment of the ozone standard. And interestingly, the governor of Colorado actually supported our downgrading, which is not a common thing at all. The current administration at the state the current governor really cares about this issue, and being downgraded actually gives him more legal tools to use to try to force industry to reduce precursor emissions. Now, under federal law, once you are defined as being a serious non-attainer, you have to make sure you get within attainment very quickly. So ostensibly, we need to get within attainment by 2021. It's very unlikely to happen for practical reasons about how that ozone regulation is structured. And so when Colorado submitted a plan to the EPA for how it was going to get into compliance, it said, okay, well, 2021 isn't going to happen, but we'll get there by 2023. That's, a more realistic time frame, and I kind of understand why, but it's a real bummer for those of us who live here in the Front Range and enjoy breathing. It's also important to note that the ozone standard that we are out of compliance with is actually not the current one. It's the old one that's looser. So the current one is 70 parts per billion. The old one is 75. We're a little over 75. So even once we hit that 75 and we get in attainment with it, we then still have a whole lot more work to do to meet the current standard. So let's pivot here and talk a little bit about COVID-19 and what we know about air pollution and how it interacts with COVID. We don't know a whole lot, actually, and so I want to just have a disclaimer here that none of the studies in this section that I'm about to show you have been peer-reviewed yet. They are in the process of being peer-reviewed, and some of them are being kind of continually updated, but they haven't been peer-reviewed yet, and so we just have to take them with a little bit of a grain of salt. All right, so you may have some questions about air pollution during this COVID pandemic and the shutdown. So one question that people often have is the air cleaner during the coronavirus shutdown? Is it just cleaner now? Because the economy has slowed down, does that mean that emissions have decreased? And certainly if you look out the window, like I did from my car in the Rocky Mountain Arsenal last weekend, it certainly seems like there's less air pollution, because usually there'd be a sort of band of brown, orange, gray along the horizon, even on a day this cloudy. But didn't see one that day. So, your intuition about air pollution being lower is certainly backed up by my intuition, but intuition is not data, so it's important to go back and actually check the data. And there's a company called Descartes Labs that has done a bunch of mapping of satellite data for NO2 for a bunch of different media outlets. So they did this one analysis for the Washington Post, they've done it for the Guardian, the New York Times. So this analysis they did for the Washington Post, they looked at nitrogen oxide, which again is from traffic and heavy industry, over the 5 weeks or so from March 1st, April 5th, 2019, and then again comparing that to 2020. And you see big drops in NO2 in New York City and the surrounding regions, as well as in the Ohio River Valley, where there are a lot of power plants and heavy industry that has shut down during the coronavirus. So yeah, there's certain parts of the country where it's gone way, way down, but we're really interested in Denver here, or at least the Front Range. So what does the satellite data say for the Front Range? Well, looks like there has been some decrease. It's a little hard to tell exactly how much because the scale is from less to more rather than in units. But at least the satellite data seems to be suggesting that at least for NO2, there is less of it. Now it's satellite data, and sometimes satellite data gets confused between air pollution high in the atmosphere and air pollution low in the atmosphere. So it's good to go back and look at what the ground-based monitoring says as well. And that's actually what the Denver Post asked the Colorado Department of Public Health and Environment to do a few weeks ago. And Colorado Department of Public Health looked at the ground-based monitoring, comparing all of March 2019 to the first 3.5 weeks of March 2020, found that fine particles were down almost 50%, large particles almost 40%, sulfur dioxide maybe 45%, nitrogen oxides about 25 to 30%, carbon monoxide down about 20%. So across the board declines for at least these air pollutants. interestingly, the state didn't really want to do this analysis. And the subheading for the story is investigating these trends is, quote, premature and, quote, not a priority during the current health crisis, state officials emphasize, as if all other health problems go away during coronavirus. I have issues with that framing. So, is the air cleaner during the coronavirus shutdown? Yes, but there's still some things we don't really know. It's unclear whether the shutdown and also the oil crash that happened at the same time have led to lower emissions from the oil and gas sector, and whether that's led to lower concentrations of like the VOCs and diesel particles that are related, at least in part, to oil and gas. Now, the reason we don't have data on these yet is it actually takes a few months to process them. So it's not actually a surprise we don't have that information yet, but we would like to have it, soon. What's a little more surprising is that the state didn't report whether ozone levels have dropped. And you might be wondering if they did, whether that would help us get into compliance with the ozone regulation the EPA has. Probably won't, though. The EPA standard is focused on the highest ozone days. That is the top, 5 to 10 ozone days in the year, and kind of ignores the rest of the year. So lowering ozone in the spring when ozone isn't that high anyway, it's probably not going to help with the attainment, unless the shutdown continues through the summer. If the shutdown continues through the summer and ozone precursor emissions stay low, then maybe it will help. But for now, it will not have helped. Now, that doesn't mean that lower ozone in the spring isn't a good thing, because there are no safe levels of ozone as far as scientists can tell. More is always bad. So lower spring ozone would still be good for us. Okay, so we can be grateful for that at least. Another question, does air pollution exposure affect susceptibility to SARS coronavirus infection or death? Sorry, this is the official name of the coronavirus that causes COVID-19, is SARS-CoV-2. Okay. Well, it's actually pretty plausible that air pollution would increase susceptibility. There is a really nice story that lays this out in the Los Angeles Times on March 21st that I encourage you to go and read, that sort of describes why we know this. But in an interview, this one professor at Harvard says there's lots of evidence that air pollution increases the chances that someone will get pneumonia, and if they get pneumonia, that they'll be sicker with it. And as of March 21st, we don't yet have direct evidence of that with COVID, but I would be surprised if air pollution did not affect risk for COVID infection and severity of illness. And there's evidence going back to other outbreaks of other coronaviruses and other respiratory diseases that kind of backs up this intuition. So there's evidence from SARS. There's other evidence that's not mentioned in the story from influenza epidemics, including all the way back to the 1918 influenza outbreak, showing links between air pollution and rates of death. Now, this was again written in March 21st, and there's actually been a flurry of preliminary studies that have come out since then that do suggest there is indeed an effect of air pollution on susceptibility. So the most famous was this one that came out of Harvard about 3 weeks ago, which found an increase in long-term air pollution exposure over several decades, and PM 2.5 was associated with an 8% increase in the COVID-19 death rate, which is actually a pretty big number in a place like New York City, which has a high number of overall deaths. Now, when this study originally came out 3 weeks ago, this number was 15% instead of 8%, but they have done the, I think, responsible thing and continually updated their results as new death data have become available, and that led them to change their estimate, which is fine. That's exactly what should happen. And since that study came out, there have been a couple others from Italy that have found sort of similar things, but instead of looking at really long-term air pollution, they've looked at kind of shorter-term air pollution. So here's one looking at just a few weeks of air pollution in northern Italy, in particular PM10. They found that the number of times that PM exceeded their version of the EPA standard appeared to be a predictor of infection, not of death, but of infection. So less polluted provinces had lower infection rates than higher polluted provinces. Another study in England found sort of similar things, but instead of looking at PM10 exceedances, it was looking at nitrogen oxides and ozone, and found links with COVID deaths in different counties in England. So again, none of these studies is really open and shut and super conclusive, but the fact that they're all sort of pointing in the same direction and they're all consistent with what we know from older studies of other infectious disease outbreaks is, pretty suggestive. So does air pollution exposure affect susceptibility? Very likely it does. We have preliminary data on long and short-term exposures being correlated with higher infection and mortality rates. The results are consistent with what we know from other coronaviruses, influenza and pneumonia. Now, none of these studies are super strong in terms of study design, because it's the only thing you can do quickly is generally a study design that isn't that strong. So it's not surprised that the first evidence that came out is perhaps not as strong as you would like. What would be great is if we could back up these results with other study designs where we have a cohort that we follow over time and look at their COVID status every couple of weeks, maybe, or look at mechanistic models where we expose cells in a petri dish to both COVID and to air pollution, things like that, to try to understand really what's going on. But the studies we have so far are the best that we can really reasonably expect on such short notice. Another question, do airborne SARS particles, or sorry, COVID-19 particles, interact with air pollution? The answer is probably yeah. There's actually a study that got a lot of media attention last weekend where researchers who collected PM10 samples on collectors in Italy were able to find evidence of SARS-CoV-2 viral RNA on those particulate samples. Again, there's only one study that's tried to do this yet, but there's lots of other people looking into it, that even people I know personally. So it's a big area of research. So yes, we know that particles can kind of hitch a ride on, virus particles can hitch a ride on other air pollutants, but we don't really know what that means. So the results from the Italian study are consistent with what we know about the ability of other pathogens like bacteria and fungi to hitch rides on particles. If the particle has lower density, then it'll be more buoyant and likely to stay in the air and float around. Attaching to PM could enable virus particles to remain in the air for longer than they would by themselves if they are attached to a more buoyant particle than they themselves are. However, we just don't know what that means for transmission dynamics. Does it make it worse? Does it have any effect whatsoever? There's just no evidence one way or the other. Now, I also want to talk a little bit about ozone, because I've seen advertisements for indoor ozone generators that you can put in your home ostensibly to kill coronavirus particles in your home. And it is plausible that ozone might actually degrade virus particles in the ambient environment, because we know that that kind of thing happens with bacteria and with pollens and other kinds of floating things that make you sick. However, I strongly recommend you not buying an indoor ozone generator, because ozone levels in your house, if they're high enough to kill a coronavirus, they're high enough to hurt you. Inflamed lungs are susceptible lungs. So it may kill the coronavirus, but it will make you sick in other ways and make you more susceptible to coronavirus. So please don't go out and buy one of these generators thinking it will help save your life, because it probably won't. So what about climate change? I haven't really talked about that yet, and obviously really important from an air pollution perspective, but also has interesting relationships with coronavirus. So I'm going to have 2 slides just on climate change and then talk about how it relates to these other things. So first, let me just show you a plot of global CO2 concentration, basically for the past 800,000 years. Basically the whole time it's taken modern humans to evolve. And we see that the global CO2 concentration in that time period up until about the year 1813, the beginning of the Industrial Revolution, sort of oscillated between about 180 parts per million and about 280 to 300 parts per million. So roughly 100 part per million range, which, to give you a sense of scale, like the last time CO2 was in one of the troughs, there was a half-mile thick ice sheet on top of New York City. This is an ice age. These little troughs here correspond to ice ages, which is a very different climate than the one we are used to. So it only takes about 100 part per million change in global CO2 to melt a half-mile thick ice sheet on top of New York City and send it retreating off to Greenland. Okay, so 100 part per million is a big change if given enough time. Now, over the past 200 years, since the beginning of the industrial, well, let me actually just give you a sense of scale here before I get to that. Basically, all of human urban civilization has developed during a time when CO2 was actually at the high end of this range. So after the deglaciation started. So basically all urban civilization existed while CO2 was above 250 parts per million and below about 300 parts per million, up until the Industrial Revolution. So in the past 200 years, we've added another 130 or so parts per million. And we did that really, really fast. You see this slope is basically vertical on this timescale, much faster increase than we've ever seen before. And in fact, even going back millions of years, it's the fastest increase that we've seen for a very long time. The overall impact of that was to raise global surface temperature by about 1 degree Celsius, which doesn't sound like a lot, actually. You know, if you think that 100 part per million change in CO2 is enough to melt a glacier on top of New York City, why haven't we seen a bigger change given the 130 parts per million we've added since then? And the reason is it actually takes a while for the Earth to absorb all the extra heat that the added CO2 allows for. Particularly the oceans can absorb an immense amount of heat before they heat up. All right, before the water temperature increases. Now that's a good thing because it means we haven't like cooked ourselves yet. We haven't already raised global surface sea level by like 50 feet. But it's also a bad thing because even if we halted the carbon emissions and just held global CO2 levels at 410 indefinitely, the climate would still continue to warm as that excess CO2 we've already emitted absorbs more and more heat, okay? So even if we stopped all emissions today, we'd still see significant sea level rise and significant temperature increase. Now, it's instructive to sort of think about what are the trajectories for the future, because we've already changed our climate a lot going forward. We're just only in the first stages of noticing it. But what is going to happen in the future? What do our emissions trajectories look like? Obviously, we don't know exactly because, you know, we have choices in the matter, but it's instructive to look at the scenarios that scientists and policy wonks about 10 years ago put together to discuss different trajectories for our emissions and what that means for the world. So again, these are just hypotheticals invented 10 years ago by policy guys, but you know, important to show kind of what is likely and what is possible. So there's like a low emission scenario where we aggressively fight emissions starting in 2010. We only end up at about 420 parts per million in the year 2100. There's a moderate emission scenario where we max out at 540 parts per million in 2100. There's a somewhat higher emission scenario where we max out at 625. And then the burn everything we can get our hands on, business as usual scenario, we max out at 930 parts per million CO2. There has not been this much CO2 in the atmosphere in I think over 50 million years. This is a radically different world that we would be putting ourselves into if we allow CO2 to get this high. Again, we have a choice in the matter. This is not destiny here, but you know, it's hard to imagine how we feed 12 billion people in a world this radically shifted from the one that we are used to. And in addition to that, CO2 levels this high literally make you stupid. Like there are studies showing that cognitive ability declines noticeably when CO2 gets to about 1,000. So this is not a world we want to live in. And so you might be wondering, these scenarios were put together 10 years ago. Where are we now? Are we on track for, you know, the nightmare world or somewhere kind of maybe less nightmarish? And it turns out we're not quite in the nightmare world. By 2018, we'd sort of fallen off the red track, which is the high emission scenario. And so now we're sort of on course for sort of somewhere in here, maybe let's call it like 500 to 700, maybe 500 to 800 parts per million. Still not good. Still radically changed the world from the one that we know how to live in. But you know, every part per million we shave off that final concentration, the better. Now, what do these scenarios mean for temperature? So under the high emission scenario, the temperature would get up to about 4 degrees Celsius on average above the late 20th century average. So compared to, you know, roughly the year 2000, we'd be looking at, let's call it 7 degrees or 8 degrees Fahrenheit warming on average around the globe. With lower emissions, our temperature increases less and less. But that's global average. And the important thing to know here is that the whole Earth doesn't warm the same way. Actually, the poles warm much faster than the tropics, and land masses warm much faster than the sea. Remember, the sea is a great heat sink. It can absorb a lot of heat energy without warming up. So the land is not nearly as good at that. So the land heats up a lot faster. Now, we here in Colorado are kind of halfway between the poles and the tropics, so that's a wash. But we are definitely inland, and very, very inland, very far, many hundreds of miles from the nearest ocean. So you think about these sort of ranges for temperature increase. These are really rough lower bounds for us here in Colorado, is what you should think these of. It would not be crazy for us to consider that temperatures by the end of the century would be 10 degrees Fahrenheit higher than they were at the beginning, which would be a really huge change. I mean, going from the climate we have here now to the climate of Albuquerque, New Mexico means a whole lot more aridification. Now, temperature also makes air pollution worse. This higher temperatures increase ozone just automatically because that's how ozone works. That chemical reaction that forms it goes into overdrive when temperatures go up. So even though we're having a real hard time controlling our ozone here on the Front Range right now, it's just going to get harder and harder as time goes on and temperatures continue to increase. So another reason why it's important to try to limit our carbon emissions now to try to save us from higher ozone increases later. In addition, warmer temperatures mean drier forests. We've already seen huge increases in the numbers of acres burned and the number of really exceptionally large wildfires over the past 50 years in the US. It's not entirely due to climate change. There's a lot of other factors in play there too. But going forward, that climate driver is going to be stronger and stronger. And so we can anticipate significant increases in wildfire smoke exposure, not just in California, but that smoke, spreads thousands of miles downwind and can impact people who don't live anywhere near forests. And in fact, the only scenarios I've seen where wildfire smoke actually goes down over the 21st century, or by the end of the 21st century, are the ones where we burn so many forests through mid-century that we essentially run out of wood. Not exactly run out of wood, but we have much less wood than we started with, and so there isn't enough to burn to make as much wildfire smoke. That's not a fun place to be either. And finally, warmer temperatures means that the air can actually hold water for longer. So water vapor doesn't precipitate out as often, but when it does, it precipitates out in larger quantities. So a generic prediction of climate change is that we will have more drought, but also more extreme rainfall. So the drought issue is actually really important, particularly in the Southwest. We already have had severe droughts in the Southwest and the Great Plains in the 20th century. And at least for this one climate projection under that high emission scenario, virtually the entirety of North America will be in drought consistently for the last 50 years of this century compared to the 20th century average. And in fact, it sort of gets worse and worse over time. So that drought index kind of falls off a cliff after about 2050 and just keeps getting worse. Again, this is under that high emission scenario. We have a choice about whether to avoid it. But if we don't avoid it, we have a lot of trouble ahead of us. So what about COVID and climate change? And that's really the last topic I'll discuss here. What are the interactions there? And because they're not super direct necessarily, but turns out there are some indirect effects. The drivers of climate change increase the risk of maybe not this particular COVID precisely, but of a global pandemic in general. So things like human population increase. Obviously, there are no carbon neutral humans generally. So, the more people you have, the more emissions you have. Also, the more people you have, the more likely that a virus that jumps from animals to humans is going to be able to find a way to spread amongst humans. Quick, easy international travel. Obviously, there's a carbon footprint for international travel. 2.5% of our annual carbon emissions are from airline traffic, at least as of last year. And it means that a disease that's been established in one city can hop to the next city in a totally different country on the opposite side of the planet quite easily. And finally, habitat loss and increase in the urban wildland interface. As we burn down forests for mining or farming, we're releasing that carbon into the air, never to bring it back. And at the same time, we're increasing the risk that people will be moving into lands inhabited by animals that carry viruses in them that can easily jump to us. On the other hand, the effects of climate change can also increase the risk of a global pandemic, for example, by increasing political instability and lack of cooperation and just sort of people being angry with each other. We see that between countries, we see that within countries, even here in the US. And, you know, climate change can also cause things like droughts that push farmers off their land, that then causes political instability. The civil war in Syria, there's a strong argument to be made that that was caused or exacerbated by a drought. That caused a mass migration of refugees into other countries, particularly in Turkey and then on into Southern Europe. And, you know, refugee camps are a perfect breeding ground for respiratory diseases. But what about, you know, maybe there's a silver lining. Maybe this global recession is causing carbon emissions to come down. So is it? Well, certainly energy use seems to be going down. If you look at sort of the annual change in energy use year by year, the predicted change in energy use this year is -6%, which is the biggest drop since the end of World War II. Again, that's a prediction. We're not all the way through the year yet, so we don't exactly know, but it's definitely going to be big. Definitely going to be bigger than the energy drop during the Great Recession, during either of the oil shocks of the 1970s, and pretty much any time since most of us have been alive. Now that drop in energy demand is across all sectors of energy, not just you know, carbon emitting ones. But if you break it down by sector for the last year, or for the projections of this year compared to last year, oil and coal are predicted to show the biggest drops, and actually renewables are expected to have increased demand this year, which is kind of nice. It's sort of a little bit of what we need. This is also weird because it's coming from the International Energy Agency, which historically has vastly underestimated the impact of new renewables. So the fact that they're the ones predicting this really is saying something. Now, this is just energy usage, not necessarily carbon emissions. So, but it turns out that people who've done similar calculations for CO2 are estimating the annual drop in CO2 will be about on the order of 4 to 8% from 2019 to 2020, depending on who you ask. That's pretty substantial. Again, one of the biggest drops we've seen, possibly the biggest drop we've seen since the end of World War II. Now, what does that mean in terms of the Paris Agreement? Well, we need a drop roughly that size every year for decades to meet the 1.5 degrees Celsius Paris Agreement goal. We're very unlikely to see that happen because as the economy comes back from COVID, usually CO2 emissions go back up after the end of a recession. We can hope that that doesn't happen. We can try to make policy decisions to keep that from happening, but for now, that's probably the thing that we can expect to have happen. So this will not really help put us on track for Paris. Could just be a short-term blip. So recessions are not a great way to get consistent carbon reductions. Again, because once the recessions end, carbon emissions go back up. And at the end of the day, whether we reduce it 4 to 8% or not, CO2 concentration in the atmosphere is still going to rise. And from the perspective of global warming, that's what really matters. What is in the atmosphere now? And that's still too high and something we really need to be figuring out how to reduce. So what are lessons learned about COVID and climate change that hopefully we can use as the economy reopens and we kind of plan ahead for future disruptions? So lesson one is the things we should have been doing to prevent climate change are the things that would have helped us prevent COVID-19. So things like preventing the land clearing, preventing the breakdown of habitats. You know, those would have helped prevent climate change because then we wouldn't have cut down so many trees. But they also would have helped prevent COVID-19 because it would have meant that we have fewer interactions between wild animal reservoirs and humans. Lesson two, the things we should have been doing to prepare for climate change are the things that would have helped us respond to COVID-19. So here in the US, that's from practical things like, you know, pre-positioning supplies like ICU equipment, ventilators, personal protective equipment. We did some of that. The government did have a stockpile, but we went through it in just a couple of weeks. And much of the equipment that was stored there was no longer usable because it hadn't been properly maintained. So yeah, we did a little bit of it, but we needed to do a lot more. And you know, as climate change comes, we're going to have disruptions like this. They may not be from diseases, they may be from flooding and hurricanes, they may be from fires, but we're still going to need our medical systems to be prepared to respond to those crises as well. So thinking ahead, we shouldn't just be thinking to the next week or the next month, or how do we open the economy, in the near future, or what does the economy look like next, in the fall. Now, we really need to be thinking about reopening the economy in a way that prevents this kind of crisis from happening again, that decreases the risk of, that we'll have to have this kind of shutdown again in the future. And so my hope is that, we sort of, we spend some time thinking a little bit longer term than our policymakers right now want to do. They are busy responding to this crisis in a very short-term way of thinking, and it is up to us to try to encourage them to do otherwise. And so the thing that I like to point out that is an actual just demographic fact that I keep coming back to is that half of the babies born in the United States this year will live to see the turn of the 22nd century. That doesn't seem possible. I mean, if you just sort of read it out loud, it seems ridiculous because the 22nd century seems like super far in the future, Star Trek and stuff. But it's less than 80 years away. Life expectancy at birth is 79.5 years, at least in the US. So that means half the babies born this year are going to still be alive in the year 2100. Even though that seems so far away, we don't even bother modeling climate into the 22nd century. We probably should. We should be thinking about what world we are leaving to them to inherit. We are making decisions that affect their lives profoundly, and yet they have no way to advocate for themselves because they're babies, they're children. It's up to us to do the advocating on their behalf. That is our job. That is our responsibility, is to make sure that even if they can't vote, that their voices are heard. So that's it for my talk, and I really appreciate it. And I guess we can now go to questions.
Thank you so much, Dr. Crooks. I love that photo. I've seen you do this presentation a couple times, and it gets me every time. And so for folks that have questions, feel free to use the chat or the questions bar. We have one to start, and so I think we can go ahead and do that one first. And as folks type their questions in, I'll read them out loud so that Dr. Crooks can answer them. All right, so the first question is, so it seems like ozone came a little later to the EPA list than the original EPA standards for monitoring. How complicated is it to get a new one added? So I guess a new pollutant added, and what are some that we could possibly see in the future?
So I think ozone was on the original list, but if you're asking about how hard is it to add new pollutants to the list, it's hard. It certainly takes a bit of effort. I think the original endangerment finding for greenhouse gases took somewhere on the order of 10 years from the Clinton administration to the Obama administration. The Bush administration sort of tried to sort of slow that process down. And of course, once the endangerment finding occurs, then industry groups or other interest groups sue the EPA to say, no, it's not dangerous. And that then took a while. And it took many years for, the EPA to really establish its endangerment finding and make sure that it was sort of legally defended and that, it was clearly legal. All right, so that took a long time. And as we see, those endangerment findings are pretty vulnerable toward a change in administration too. So the current administration has tried to roll it back. But you also asked about what about new air pollutants? And there are certainly air pollutants that are not on those lists of hazardous air pollutants or criteria air pollutants that we sort of find out about, like, some of the VOCs that were just not really well understood at the time could be added to the list. But usually the things that emit the new pollutants also emit the old ones. So putting controls on the old, based on the old air pollutants usually helps with other ones too. And so I'm trying to think if there's any efforts ongoing right now to add any air pollutants to the list through a new endangerment findings, and or even under the Obama administration, if there was something like that, and I just can't think of any. I think the last one they tried was the, the greenhouse gas one, and I just can't think of any other examples.
Awesome. Thank you. All right, we got a question from Nick. In really rough terms, what are the largest sources of VOCs? Are cars a bigger issue than oil and gas development, for example, when it comes to volatile organic compounds?
Okay, so that really depends on where you are. But if we're talking about the North Front Range region, the most recent studies that I've seen where, CDPHE contracted with a bunch of researchers to go out and actually study like where are the VOCs and the ozone precursors coming from, they found that something like a quarter to a half of the ozone problem in the Front Range was at the time, which is like 2013, due to oil and gas emissions. What that means for VOCs is probably a higher percentage than that. But again, I don't know the strict details because that's not really my specialty. So there are other people who could probably answer that question better than I can, but it's significant. And, there are those, it seems like in the oil and gas industry and their friends who seem to think that the oil and gas industry has no impact on air quality or that air quality is irrelevant. Obviously, it's not irrelevant from a health perspective, and it is implausible to argue that oil and gas has no impact on air quality. Like that is just not, that doesn't even pass the lab test. Like there's no way that's true. What the actual number is, I just don't know.
Great, thank you. Got a new question. To just what level would we need to transition our fossil fuel use to renewable use in order to maintain breathing the relatively less polluted COVID air we are seeing today into the post-COVID future?
Well, it took a 6% decrease in overall energy usage by the world to get us to, on an annual average. If there's actually another plot that I saw, maybe I can actually show it to you now, that I had originally had in the talk and then took out for time. But so this plot here shows weekly gasoline and jet fuel use in the United States over the past 30 years. All right, and by far the biggest week-on-week drop-offs we've ever seen are from March or February, I guess, is when this time series ends. So 52% decrease in gasoline, 75% decrease in jet fuel. Other sources of carbon emissions have not decreased that much. Coal didn't decrease that much. Other uses of oil didn't decrease that much, like, using oil for shipping or for home heating. They did not drop off quite the same way. But it would be pretty significant. In order to meet that 1.5 degrees Celsius goal, we need to be thinking real hard questions about not just like, do we help, do we put more solar panels on our houses, but real significant structural changes to the economy.
Oh, I'm sorry, y'all, I was muted. Can you hear me?
Yeah, I can hear you.
Okay. What is the most effective effort to make right now to make the turn of the century look like a good time to be trying to live on the planet? I like that framing.
Yes, I think, it's a mistake to think we can put all our eggs in one basket and solve this problem. Like we need to be addressing lots of things. We need to be acting on a personal level. We need to be acting collectively. We need to be, changing our own behavior, trying to change our politicians' behavior. I don't know that there's really one thing we can do because this problem just is not amenable to sort of single solutions. Certainly, like if you wanted to start something tomorrow, and I just will throw out an idea, and certainly like no judgment if you can't do it or don't want to do it, but one thing that anyone can do tomorrow, presumably, is just eat less stuff that comes out of a cow. Dairy and beef have a huge carbon footprint and a huge land footprint and a huge deforestation footprint, huge water footprint. So just eating less of that would be super helpful. Not everyone can do that. Not everybody wants to do that. I totally understand. That's just one thing people can do. Use this opportunity of craziness to try to figure out, hey, would it be possible for me to bike to work instead of driving? Driving actually has a very large carbon footprint. I mean, travel, you know, it takes a lot of carbon to move people around with a car, much less an airplane. So, you know, thinking about ways that you can travel using your two legs instead of burning fossil fuels, always a good idea. Not everyone can do that either. But just, you know, there are lots of things you can try. Replacing your personal, like your stove and your home heating and your water heater and stuff like that. As they come to the end of their useful lifetime, make sure that you're replacing them with something that's not carbon emitting. Because a lot of like water heaters work on natural gas. Replace them with something that's just electric, and make sure you're getting your electricity from some place that has, you know, low carbon power generation. But at the same time, also work together with others to press your elected officials to make policy changes. Because even if 5% of people decide to stop eating beef or decide to replace their appliances or decide to bike to work, that's really not going to be nearly enough. At some point, there just have to be big structural changes to the economy, and only the political process can make that happen.
Well said. And we have a comment from the person that asked that question. They said, I was an asthmatic kid through the 60s and 70s, and I know it made a huge difference in the quality of life after the emissions from factories, vehicles, and home products like spray aerosols, where it sounds like when those issues were addressed. So thank you for that question. I think Dr. Crooks is absolutely spot on that it takes addressing things through all of those channels for us to make the big change that needs to happen. All right, as a follow-up to that question, mass transit with lower polluting devices, for example, you know, we're seeing pollution in other nations. How can we impact not only the pollution that's happening here, but pollution that's happening in other places?
Well, it's really hard to compel other countries to lower their emissions, but what we can do is help drive the economies that depend on clean burning, you know, not clean burning, but sort of clean power, clean vehicles. Try to, you know, be the market for those, so that using economies of scale, the prices can come down, and even developing countries can afford electric buses, or, you know, that kind of thing. So the way that we can help is we can subsidize the use of, you know, I don't know, solar panels and wind turbines in other countries. So we can sort of subsidize them directly. And in fact, there's a case to be made that we should do that just as a matter of justice, because so much of the climate problem is caused by industrial countries, in particular us. So we have might say we have a moral obligation to support other countries' transition. But even if you don't believe that, you know, there's a lot we can do to just support the markets to bring down the costs, so that other countries can afford to, you know, grow their economies in clean ways.
Well said. All right, I'm going to try to do these in order as they come in. Why does northern Colorado seem to be in worse shape than further south?
Well, so that's interesting, and probably the big reason is, you know, there's traffic to the north and traffic to the south. There's people to the north and people to the south. What's different is that there is oil and gas development to the north and much less to the south. So northern Colorado, particularly Weld County, and the area, sort of the triangle north to northeast of Denver within Colorado, is one of the highest density areas in the state of oil and gas development. And there's much less of that south of Denver. So I think that is probably the big reason why. And so it's not just about the gas, you know, the oil and gas leaks itself. It's also about the big diesel trucks that have to go in and out of the, you know, fracking sites and develop them, and it just takes a lot of heavy industry to keep that the oil and gas development boom going. So yes, it's about gas leaks, but it's also about the other vehicles and stuff that are there maintaining the equipment and setting up the equipment.
Which is why we gotta stop it. Not easy, but we're working on it. This looks like our last question, but if folks have more that they want to ask Dr. Crooks, feel free to put them in the chat or in the questions box. This question is, what can we do to improve interior air quality?
So interior air quality, that is a great question. There are things you should not do if you want your indoor air quality to be good. You should not do things like burning incense or burning those little like oil pods. You should not be smoking indoors, kind of obvious stuff. Cleaning out your air filters, making sure that your carpet has washed and is not just full of dust mites that are irritants. So those kind of things. And if you still have problems with indoor air quality, there are filtering devices you can buy. Like you can buy filters for particulates that work pretty well. You can get your particulate levels down by about half. But you know, that really only makes sense if the particles are coming in from outside. So you may want to tighten up your home. If it's the indoor, if you have indoor sources of particles, you should probably just try to address those at the source rather than try to filter them out if you can.
Great advice. I'm really big into Yankee candles, and I learned recently that there are some, I forget what the pollutant is called, but there's some pollutants in them that make them toxic to people, which maybe is why they smell so good. I'm gonna try to
you know, I feel like my exhortation not to use the burning oil falls on deaf ears in my own home sometimes. So yeah, but I mean, people like the smells, and you know, if you don't have a respiratory disease, it's probably fine. The issue is if you do have asthma or you're susceptible to respiratory diseases, or if you're sick, just know that those things are going to make your life a little bit worse.
Wow, that I had no idea. Someone responded, "Oh, if you can smell it, don't burn the candle."
Yeah, and it's not even, you know, even beyond that, there's stuff that even things you can't smell. Like if I used to have a natural gas stove in the house, and those do leak a little bit, and they increase the nitrogen oxides and VOCs in your house in ways that you normally can't smell at all and have no idea are there, but are actually, you know, hurting your lungs without you even knowing. We replaced it with an induction stove, which works great. I love those things. But yeah, you know, you have to be careful. There are sources that you can't even smell to.
Jeez. Well, day at a time. All right, we've got a couple more questions. Since you're from National Jewish Health, Dr. Crooks, are we going to need people to use masks at all times in polluted areas?
Good question. Actually, a lot of those masks don't really do much for the fine particles, which are the biggest health risk. So the N95s, even I think they do a little bit, but you have to, make sure that you're using them exactly the right way. They're not really designed to be used in like mowing the lawn. They're designed to be used in a hospital setting. So unless you're using them exactly the right way, they're not going to really do much. And the other kinds of filters, like the just cloth masks that people are wearing right now, they're not going to do much for the fine particles. They'll do a little maybe, but the fine particles can just go right through those cloths very easily. Again, for the COVID, it's useful to have them just because they tend to collect those water droplets that might have the COVID virus in them. But in terms of the fine particles that affect your health, they don't do a ton.
That's a great point. Another question, how do you personally deal with high ozone days?
How do I personally? I stay indoors. I mean, that's kind of the obvious thing. Yeah. Usually my lungs tell me when it's too high and I just stay indoors.
It's an easy one, easy action to take. So this one, this next question is more of a request for a comment. So could you comment on not just the Northern Colorado fracking and truck traffic and those pollution issues, but for example, other things like frequent venting, VOCs, NOx particulates, et cetera, et cetera, et cetera. Are there, and then I'm not sure if this question is associated with that, but are there types of materials that we could add to make the masks better?
I'm not really sure I understand the first question. The second question, I'm actually not really sure. I don't know a ton about the masks. Usually that, when people develop masks, they're there to stop the particles. Now, ozone reacts with everything, so it will, if it touches that mask, you will not be breathing ozone. So, in one way, the mask may help a little bit with that, because it will react with the mask rather than with your face. But in terms of materials for other kinds of things, there are just so many different kinds of air pollutants. It'd be pretty hard to come up with materials to like filter out all of them. So I'm not real sure if that's a useful way forward.
Yeah, I know one thing. My mom told me that if you want to make your own mask, that like 100% cotton is good in that it's an accessible material that you probably have around your house. And I think that's obviously not the best thing, but if you're trying to prevent like the spread of COVID, that's one solution if you're trying to make a mask, but obviously that's not like a medical grade fabric.
No.
All right, do folks have any other questions? We've got 3 minutes left, so we have time for maybe one more. Oh, what is the best argument to use with politicians? That's a tough one.
Money arguments are the best ones to use for politicians, almost uniformly, unless they already agree with you. Basically, money arguments. Clean energy is cheap or cheaper than the fossil fuel alternatives, almost across the board, pretty much everywhere. If you look at electric cars and you look at their, 5-year total cost of ownership and 5-year carbon footprints, both of those things are lower than for a fossil fuel vehicle equivalent. So it's just cheaper to own and operate an electric vehicle, even if it's a little more expensive at the beginning. Same is true for power sources. I'm trying to think, there are probably other examples, but basically making dollars and cents arguments. So when we talk about the impact of air pollution, a lot of times when we talk to politicians, we say things like, oh, it hurts my lungs, but we haven't done the accounting of like, okay, what is the actual impact on the economy of this air pollution? It's just a bunch of people who have susceptible lungs who come in and tell a story about their lives. That's super powerful, but you need that and also the money argument. And so trying to tie, the health impacts that we know are there to dollars and cents can be more persuasive. And there are tools to do that. Like there's, EPA has a tool called BEMAP that does exactly what I was just describing. But anytime you can, tie things to money, that tends to, get people's attention.
Awesome. Well, it looks like this is my first time using GoToWebinar, so I'm pretty sure it's gonna close this out in about 1.5 minutes. We did get a couple more come in, so if we can keep them pretty short. Have there been studies on the effect of the I-70 expansion project in Denver on air quality in the surrounding neighborhoods?
Good question. We actually was part of a team that applied for money to study that and from the NIH and did not get the money. So there probably are smaller studies going on, just little pilot things, but in terms of a really big consistent one, as far as I know, there's not. But I also, I don't know everybody and I don't know all the different grants people have submitted. So there could be some and I just don't know about them. But the one I did know about, unfortunately, did not get funded.
Bummer.
Yeah.
Well, folks, I think that's it for us today. Thank you so much for joining. My only comment I'll add is that if you do live in Northern Colorado and want to get involved in our advocacy effort, fill out the petition. Here, I'll drop it in the chat real quick here. Oh, I wonder if people are cheering near you. They're cheering near me. It's sc.org/PRPA. That's a quick way to take action and then get you plugged in. Thank you, Dr. Crooks.
Well, thank you so much for inviting me. I've really enjoyed this. And I hope people's questions got answered to their satisfaction.
Awesome. Alrighty, everyone. Talk soon.
Take care.